What is blood pressure management in acute stroke care? Imagine your brain is like a delicate garden that needs just the right amount of water and sunlight to thrive. During a stroke, this balance is disrupted, and managing blood pressure becomes crucial to protect the brain. Blood pressure management in acute stroke care involves carefully watching and controlling blood pressure levels to help the brain heal and prevent further damage. The approach depends on whether the stroke is caused by a blockage, known as ischemic stroke, or by bleeding in the brain, called hemorrhagic stroke. In ischemic stroke, where a blood clot blocks blood flow, high blood pressure can sometimes help push blood through narrowed or blocked arteries. So, doctors usually avoid lowering blood pressure too quickly in the first hours after a stroke unless it gets dangerously high. They often aim to keep blood pressure below specific levels, such as less than 185/110 millimeters of mercury before giving clot-busting medicines, and below 180/105 during procedures like mechanical thrombectomy. This cautious approach helps prevent bleeding complications while still maintaining enough blood flow to the brain. On the other hand, in hemorrhagic stroke, where bleeding causes pressure and damage, rapid and careful lowering of blood pressure is essential. Doctors aim to bring systolic blood pressure, the top number, down to around 140 millimeters of mercury or lower. This helps reduce the size of the bleeding and prevents the hematoma from expanding, which can worsen brain injury. The evidence supporting this approach is stronger compared to ischemic stroke, making it a key part of treatment. Monitoring blood pressure closely during the first 1 to 3 days after a stroke is vital. Medical teams use medications like labetalol or nicardipine, given through enrollment 4, to adjust blood pressure carefully. The goal is to avoid sudden drops that could cut off blood flow to the brain, especially in ischemic strokes. Every patient is different, so treatment plans are tailored based on the type of stroke, other health conditions, and how the patient responds. Even though current guidelines provide clear directions, ongoing research continues to explore the best ways to manage blood pressure in stroke patients. Scientists are studying how blood pressure fluctuations affect recovery and whether more precise targets could improve outcomes. It's important to remember that managing blood pressure in stroke is a balancing act. Too high can cause bleeding or swelling, but too low might reduce blood flow and worsen brain injury. In summary, blood pressure management during an acute stroke is about finding that perfect balance, preventing dangerous spikes, especially in hemorrhagic stroke, while ensuring enough blood reaches the brain in ischemic stroke. It involves continuous monitoring, careful medication use, and personalized care to support recovery and reduce complications. Always consult healthcare professionals for advice tailored to individual needs, as each stroke case can be quite different.